All right, in this video, we're going to be covering the two main ways that orthopedic injuries occur. And when we talk about orthopedic injuries, we're primarily referring to damage or pain or injury associated with structures in our body, such as our muscles, our tendons, our ligaments, and our bones too as well. So all of those structures in total, along with kind of our cartilage, structures like our labrum, all feed together to make up orthopedic injuries. And in order to effectively describe the two different types or main categories of injuries, I like to use the analogy of a pencil. So the first type, and what we see most often in physical therapy and in rehabilitative type programs, is actually kind of a chronic or just an overuse or a gradual progressive thing that ends up resulting in pain or injury. And going back to our pencil analogy, if we think about just a regular number 2 pencil that you would have used in elementary school, maybe on some of your standardized tests, we can think of that pencil as being your body and your actual physical tissue, again, muscles, tendons, ligaments, cartilage. Whenever we do physical activity, or on the opposite end of the spectrum, if we do too little physical activity, we can actually start to kind of progressively and slowly apply additional stress or load onto certain structures of the body. And as long as our recovery time in between when that stress is being applied to those tissues allows those muscles, tendons, ligaments to recover and bounce back from there, we don't experience pain or injury. Now, whenever we try and kind of ramp up our activity, and maybe we have been kind of a couch potato recently and haven't been doing as much as what we normally do, and then we go out all of a sudden and try and play basketball for an entire weekend, hike multiple miles with significant elevation changes, we actually start to kind of apply additional stress over a long period of time and we don't have sufficient recovery in between, and eventually that pencil will start to break or snap from there. Now, in our second case, when we don't see this quite as frequently, but is more of a traumatic injury or traumatic process, where all of a sudden we fall and we break a bone, we reach out and we overstress or strain a muscle or dislocate our shoulder as a result of having too much stress or too much force applied on that area too quickly, which rapidly exceeds the ability or the tolerance of those structures that we've previously talked about in this video to withstand that amount of force. And then that pencil actually snaps rapidly from there. So if you were to take a pencil and pull on it quickly on either end from there, it's going to go ahead and actually break in the middle. Same thing with the tissues of the body. Even if you are fairly conditioned ahead of time and you have a traumatic incident where you fall or you're in an accident, and a lot of stress is being applied to that area really quickly, it can overload that tissue, cause it to start producing pain or not function the way that it should. And so being able to identify in which scenario that your injury or your pain took place in can be helpful in starting to kind of establish appropriate guidelines for how long it's going to take to recover for you, as well as how much time and effort you're going to have to put into fixing some of the underlying or root causes of why that pain or that injury occurred in the first place from there. And that's where we help to kind of start off as a basis with our clients, is to be able to help them identify why that injury occurred in the first place. And then based on why it occurred and what tissue was being overstressed or injured or is producing pain, or how they're moving can be responsible for producing that pain too as well. It can help us to give them a time frame as well as guidance and where they need to start off with to ultimately get from where they're at right now, being pain and injured and out of their favorite activities or out of work, back into successfully being able to return to those things as quickly as possible.